For those who I haven't met, my name is John Newman. I'm a director of Apteligen, and we've been, for the past 12 months nearly, running an evaluation of the third sector health and social care brokers in 3 West Wales counties.
I worked in education before. I'd worked in a very small environment, so I came into this completely new and completely blew my mind. We went out and met with all the different third sector organisations in Apteligen, and so it was amazing. It was to find out about all these different organisations that I'd never had anything to do with before, and to find out the services that they offer within the county.
So the brokers were in post doing this sort of mapping and looking at what services were out there and really getting to know it. So over this sort of first probably 9 months of the CRTs, actually working with the brokers, and as they got used to and their sort of suggestions about doing something different, you started to have the social worker just saying, right, well, I've got this client, what can you do for them? To then actually the social worker saying, go and talk to this person. And then we moved on from there, as I said earlier, to the self-referrals, so that we could just be open and people could just come to talk to a broker.
I think the way we're utilising Emma in our team is that she's part of the CRT, so she goes, because the area is so big, we have our multidisciplinary meetings with the GPs in their practices rather than them coming to us. And Emma attends all the GP multidisciplinary team meetings, which we hold on a fortnightly basis. So she gets referrals directly then from the GP, along with getting referrals directly from myself. So I may allocate work to Emma where it's obvious from a referral that a person is perhaps socially isolated, for example. So Emma will go out and do the first visit and signpost and direct somebody, inform them of what's available in their area. And it saves any of the care management staff going out. If she identifies as a greater need, she comes back and I'll allocate it then to a social worker or care management assistant, and they'll joint work them until the outcome has been achieved that the person themselves wants, So that has been a great help to me. There's so much out there that Emma's got that knowledge because that's what she specialises in. So, we're not missing anything.
What's really important to me is when I'm going out to see somebody, and most often than not in crisis, that I'm able to listen to them and do what matters to them, what they want, what's important to them, rather than just come away, write an assessment, prescribe a service. We are now being able as workers to do what people want.
And the more that we're able to go out and speak to people, the more the professionals can stand up and think, oh yeah, actually that does make a difference. And it's developed so much in the 2 years that we've been doing it, and it can only keep developing given the opportunity. There's so much scope out there that it really can make a big difference.
We're going to go with the easy one, is that what we've agreed? This one is much nicer, I have to agree. Yeah. But I think because there's so many aspects to the third sector broker prior to the development of the role, as in before brokers got into force. We probably need to break it down. So, who was involved before? I wouldn't focus too much on but it does.